So today we are going to talk about the kitchen herbs which are useful in the chronic pain, particularly the joint pain associated with osteoarthritis, which can significantly impair the quality of life. Now, there are a large variety of medical drugs or pharmaceutical treatments available, but they cause increasing side effects, and therefore it's useful to discuss the natural remedies or the kitchen herbs which can help to manage the pain and the inflammation that is associated with the chronic pain of osteoarthritis. The first one we are going to talk today is turmeric, commonly known as curcuma longa, and it's a very well known kitchen herb even in the Western world. The curcumin has got many curcumin, and this is having a potential anti-inflammatory and antioxidant properties. This is known to inhibit the activity of the pro-inflammatory enzyme and the cytokines such as cyclooxygenase 2 or COX-2. So it is a potential COX-2 inhibitor, and thus it reduces the pain and inflammation and the swelling which happens in the osteoarthritic patients. The second kitchen herb used commonly is ginger. So ginger contains gingerol, and the relative compounds cause anti-inflammatory and analgesic or pain relieving effects from gingerol, and this compound can also inhibit the synthesis of the prostaglandins, and prostaglandins are inflammatory mediators, and therefore suppression of the inflammatory pathway happens when we take the ginger, and this is quite beneficial in reducing the pain and inflammation in the osteoarthritis. The third kitchen herb is green tea or Camellia sinensis. The catechins in green tea, particularly epigalactogen galeate or EGCG, have antioxidant and anti-inflammatory properties. These compounds may inhibit the inflammatory process and reduce the cartilage degeneration in the osteoarthritis. The fourth herb we are going to talk today is rosemary, also called as Rosmarinus officinalis. So rosemary contains compounds like rosmarinic acid and carnosol, which have anti-inflammatory and analgesic properties, and they might inhibit COX-2 enzymes activity, and they reduce the pain and inflammation, and it is very similar to some medically used COX-2 inhibitors, reducing the pain and inflammation, and is thus quite good kitchen herb. Next one is casein pepper or capsicum annum. So capsaicin is the active compound in the cayenne pepper or the kitchen pepper, and that desensitizes the pain sensing neurons. So the topical application of capsaicin can reduce the pain sensation and making it potentially benefit for chronic pain and osteoarthritis. So cinnamon or cinnamon verum is the next kitchen herb, very commonly used, and cinnamon contains cinnamaldehyde and other compounds with anti-inflammatory effects. By reducing inflammation, it can indirectly help and alleviate the pain associated with osteoarthritis and other chronic pain conditions. The next common kitchen herb is garlic or Allium sativum. Garlic contains sulfur compounds such as allicin, which have anti-inflammatory and antioxidant properties. These compounds can inhibit inflammatory enzymes, potentially reducing the pain and inflammation in osteoarthritis. Now, frankincense or Boswellia serrata is the other kitchen herb. While it is not typically or commonly used in most kitchens, the gum resins of Boswellia have been traditionally used for pain and inflammation. Its active compound, boswellic acids, inhibit proactive and pro-inflammatory enzymes like 5-lipoxygenase and may also prevent the cartilage loss. So, Boswellia serrata or frankincense is potentially a 5-lipoxygenase inhibitor and thus reduce the pro-inflammation stage and reduce the pain and the swelling and the cartilage problems. The ninth herb we are going to talk today is willow bark or Salix ep. So bark of willow tree contain salicin, which the body converts to salicylic acid. Now we know salicylic acid has traditionally been used as non-steroidal anti-inflammatory drug or agent in the allopathic medicine or Western medicine. So this salicylic acid is a natural precursor to modern day aspirin and reduce the pain and inflammation in a manner similar to the other non-steroidal anti-inflammatory drugs. The 10th herb I'm going to talk about is stinging nettle or Urtica dioica. So stinging nettle contain compounds that can reduce inflammatory cytokines. It has been traditionally used to relieve the joint pain and might be beneficial in the osteoarthritis and other arthritis. So we talked about these 10 herbs which can have potential benefit, reduce the inflammation, reduce the pain, reduce the swelling, and overall help in variety of joint pains and osteoarthritis. There is, however, a caution: be careful when you use it. If the symptoms are not in control, contact your health provider, and we would in fact recommend always consult your health provider or health consultant or general practitioner or family practitioners or whosoever you are taking the treatment for in order to have safety in the long-term use.